Okay, I'm going to welcome you all then to today's meeting of the Public Service Board. And the first item on the agenda is welcome and, of course, apologies. Steve, can you give an indication of any apologies we've received to date?
Yeah, thank you, Chair. Apologies from Claire Swales from PAVO, Claire Bryant from the Office of the Police and Crime Commissioner, Hayley Thomas, PTHB, Jane Thomas, Powys County Council, Gavin Bone from NRW, and Richard Deering, who's just joined us, is representing Gavin today. Liz Bone from Ministry of Justice, Alison Perry, Ed Wilson, and Carla Ann Butler, sorry.
Thank you very much. And so there are some people that aren't familiar. There's that haven't been with us in the past or are substituting. A particular welcome to you to today's meeting. And if you wish to speak later, I think what we'll do is if you can just introduce yourself at that point, and we'll welcome you individually to the meeting if that's all right. So the next item on the agenda, item 2, I've got a hand, sorry.
Thank you, Chair. It's Sean Lloyd from Midland West Fire and Rescue Service.
Hi, Sean.
Can I add you one Craig's apologies? I'm standing in for you one today, please. Thank you.
Thank you very much, and welcome, Sean. Thank you very much. Okay, so the minutes then are of the meeting. They're in the agenda pack of the 11th of December. I'm just bringing those up. My screen is very slow. I did have an opportunity to have a look at them earlier, and I'm just going to check whether colleagues are content with them. So can I just have a show of hands? I just wanted to raise one matter arising, but can I have an indication of that you as a group are accepting of the minutes as they stand? Anyone prepared to agree the minutes? Now I'm wondering.
You had a thumbs up there from Carl Cooper.
Okay, thank you very much. Okay, so and we'll move to seconding those in a moment then. So I've got a nomination from Carl, and we'll have a second later, and we'll have a look at them. Now, just in relation to the minutes, there was one point in respect of matters arising from the meeting of the 25th of September 2025 that I picked up, and it was for Daniel to give an update, Daniel Burgess of Powys Council, to give us an update on sustainable food production on the county farm estate. I had been in touch with Daniel for an update, and Diane has agreed just to pass on his comments. Diane?
Thank you, Leader. Yeah, I've just got a quick piece to read out. So the report for the farm estate recommends retaining food production as a central function of the estate, but shifting towards a more resilient and higher value model. So rather than relying on low margin traditional livestock systems, the estate should support diversification into activities such as horticulture, premium livestock products, and locally branded produce. So enabling farmers to capture greater value from what they produce. So this approach emphasises shorter supply chains, stronger links to local markets, and the development of a coordinated Powys brand, while ensuring that farming remains viable and attractive for new entrants. So crucially, food production is positioned alongside environmental delivery and diversification as part of a modern, multifunctional estate, where sustainable farming practices and participation in the Sustainable Farming Scheme underpin both the long-term profitability and food security.
Thank you very much. And of course, Powys Council Cabinet this week did approve the revised farm estate policy. So do I have a seconder for the minutes, please? I'm just looking for another hand. I'll just put it on people so I can see if there's any hands arising. Is the reluctance to second it because colleagues weren't at the meeting, or you're not familiar with Sean?
Yeah, I was there, Chair, and happy to second.
Thank you very much. So we have a proposer from Carl and Sean. So can I just have a show of hands now, please, to just agree those minutes? Thank you very much for that. Thank you. Okay, lovely. Item 3 is a technical one in the sense that it's an opportunity for members present to declare any interests that they may have in items appearing on the agenda. Steve, have you been pre-notified, or I'm not seeing any hands rising? Has anyone any declarations?
I've not been notified of any, Chair.
Okay, fine. Thank you very much. In which case, we'll move on to the first of the substantive items that we have on the agenda, and the first of which at 4.1 is a workstream update from the climate emergency group that we have. And I did see Liz Hutchins. I wasn't certain whether you'd come today, Liz, but I did see Liz coming into the meeting. Liz, did you want to speak to the paper?
Hello, everybody. Yes, very briefly, we've come to the end of a programme of work in support of the climate emergency wellbeing priority, and that has left us in a position where we've now got a sound understanding of the carbon footprint of Powys, of the carbon sequestration opportunities at the most top level. We've done a climate risk assessment, and we've brought together communities across Powys to understand how these things intersect and the different roles of different sectors in achieving change, so particularly focusing on the public sector and communities. And we had an excellent event that some people on the call were at in Newtown to bring people together. So that all of that work is now on the Have Your Say Powys website as a Resilient Powys hub space, and the intention is to give a flavour of what the different actions are happening to make Powys more resilient. So the next phase of work is going to be focused for the public sector primarily on what we can do in our own organisations to respond to the climate and nature emergency and to become more resilient. But there are lots of rich insights from all of that work about what we can do as the public sector working together, and that's kind of twofold. One is specific things that were highlighted in those reports. So, for example, working together on the fire risk to Powys, so that's very cross-cutting. And then there's also the set of policies that the Future Generations Commissioner published last year that all public sector organisations are encouraged to collaborate on, and a lot of those are relevant to this area of work, and they're areas that we can work together on. So essentially, we're entering a phase where the money has run out for supporting coordinated and joint work across the public sector. The focus now must be on individual public bodies doing work in their own lane, but we do need to identify a small handful of areas where we can work on collectively. And Banai Brycheiniog has all this time been convening this work stream. We're no longer in a position to do that. We hoped actually to convene one last meeting to kind of focus on next steps. Our circumstances have changed and we're not able to play that role as convener, but we're very happy to continue to participate along with other public sector organisations about the conversations about what should happen next, and happy to be the voice in the room, drawing out all of the insights from the work that's happened so far and making suggestions about what should happen next.
Oh, thank you very much. And I would like to just extend thanks on behalf of Powys and the rest of the PSB for the sterling work the paid work that the National Park has done on behalf of the PSB. It's been of a really high quality, and I know that you and your colleagues have enjoyed actually reaching out beyond the park into the whole of the Powys and working on the the collaborative approach that we've had. I do think now we do need to find a new approach, as you've said. I think you were talking about us working in our lanes, and that's absolutely right. But we also need to be able to hover over that, don't we? And to have some oversight and to have joint actions where we can. And I think I'd like to just have a discussion amongst ourselves about how we might do that briefly here. But I also wanted to suggest that if organisations can nominate a particular spokesperson to perhaps help coordinate the work that they're doing within their organisation, and we have a steering group or whatever it's called to bring that back here. So before we meet next time, I would perhaps like, not necessarily in this meeting, but some volunteers to come forward. So Catherine is happy to draw those in and coordinate that, to get some names together so that we can collaborate to ensure that we add the extra value that you talked about in addition to working in our lanes, because we are doing some good stuff. So I open that up. I'm sure that's something, Liz, that you would be interested in and welcome. But I look to others in the room for your initial reactions, if I may, please. Do I have any initial reactions? So yes, Meredith.
Okay, thank you, and thanks, Liz, to you and your colleagues for all the work and your leadership in terms of this area. So, yeah, from a health board perspective, we do have a lead, and Steve has been working, I know, as part of the subgroup that was in place element, really, and I know we'll be happy to continue to to be part of a member of that sort of group. And I think for me, it'd just be helpful to clarify the groups that are currently in place then changing or stopping. I suppose just understanding that bit. Is it an extra group or is it a change of groups?
And I stand to be advised, it may well be just that group being charged with this responsibility. So, we might just want to reflect on whether that is still the most appropriate body to take that work forward, bearing in mind that the collaboration is no longer with the work that Liz and her team were doing. It's back here to the board itself, isn't it? But that's a useful point that you make. Richard, have you got an observation on what Liz said or the original ask?
Well, certainly we'll be able to support the group with a nomination from my team, but equally I'd welcome an opportunity at some point around what the requirement is around some sort of coordination. It is a piece of work that I undertake for the Ceredigion PSB, and it may be it is subject to me getting some additional resource into my team, which I'm working on at the moment. It might be that we could offer that service to the PSB from within NRW.
That sounds absolutely fantastic. So with those comments and offers, Catherine, can we have a pick this up outside of the meeting afterwards and discuss how best to action that? Is all right, Catherine? Is Catherine fallen out of the meeting, or am I?
Yeah, I nodded. Sorry, I didn't.
Oh, sorry, I can't see all the picture. I can't see everybody. And unless you speak, the camera doesn't come on to you with my thing. So thank you very much. Sure.
Thank you, Chair. And from a fire service perspective, I'm happy to support the group with the nomination as well outside this meeting. I'll get it sent over to Catherine.
Thank you very much for that. And is there anything else anyone wants to raise on 4.1 before we move on to the next item, which is the whole system approach to healthy? Liz?
Well, just to reflect on that then, so we have had a really well-functioning climate working group, and I think it could be a case of just taking that to the next stage of its work. actually Diane and I had a conversation about the level of seniority that is needed in this conversation, and that's something that should be reflected on, I think, in terms of the membership of this group. And as the work is embedded more into organisations, there's a kind of heads of service element to it. So I think that's a reflection that we don't necessarily need to unpack fully here, but if this is going to be a genuine priority taken through organisations, it does need to be reflected in the level of seniority of engagement. And then just a second point is that we have completed these kind of two quite substantive pieces of research work. They're not brought for a decision at this meeting because there was a view that they should go to the scrutiny group beforehand. So as I understand it, that is scheduled for the scrutiny group to look at those documents, and I expect that they might be brought back in due course to this body.
Oh, thank you. And have we got an indication which of the future meetings that are suggested at the back end of this report? So what have we got? September? Would we be able to do that in September, do you think? Liz, in terms of...
I mean, they're ready for anyone now. I'm perhaps looking to Catherine or whoever coordinates that scrutiny group.
Yeah, so yeah, we advised to bring it to the September board.
Excellent.
Yeah, forward work programme.
Excellent. So we can work back from that then. Lovely. And we can then do the necessary endorsement that was indicated that we'd need to do at that stage. And we might have a clear indication of next steps, people and processes as well that we're embedding at senior levels, as Liz has indicated, to drive this agenda forward. So thank you very much for that again, Liz, and please take the thanks back to your colleagues. Item 4.2 then. Meredith, are you happy to speak to this? We've got a paper attached.
Yes, thank you. I wasn't sure whether we were coming to the engagement and insight first. So, yeah, no, thank you. Happy to take it now. And can I also welcome Tracy Deacon is joining me, and Helen Griffiths on. I can see you on screen there as well. So I'm going to hand over to Helen to present the latest update to the membership today. But also, before Helen starts, could I take this opportunity to express my thanks to Helen. So Helen has been with us, seconded into Powys Health Board from Cardiff Public Health team, covering a period of maternity leave, and it is Helen's last day today. But I want to formally thank her for stepping in and taking forward the leadership of the health systems approach over the last sort of year or so. So thank you. Hand over to you, Helen.
Thanks very much. Thanks all. So I could just share my screen. Okay, see my slides. Okay, yeah, great. Okay, so then just to update you on where we're at as of Q1 for the whole systems approach to healthy weight in Powys. We've been spending the last quarter reviewing and revising the local delivery plan. So this is based around developing our draft action plans for the 26-27 period. Most of this work has been informed by we've had workshops working with our steering group partners and our working group members and wider partners across Powys to review last year's plans, look at what needed to change and adapt, and make sure we've got this year's plans now in place. So that's the point we're at. And we've also been doing a lot of work to listen to the community voice. So you'll be aware we did a piece of work at the end of last year, which was with parental engagement insights, which looked at how parents felt about access to healthy food. So we've really used that to inform the plans going forward. We've also been doing a stakeholder analysis. So we've looking at building the strength of our partnership really for the strategic working group, so that we can make sure the right people are around the table to develop the plans. And most of this work has really been underpinned by using the system working methodology. So things like the action scales model, which is a tool we use to help us highlight the different levels of system change. So we can really support the partnerships to understand the different levels of system intervention. So for example, it could be, you know, what we're doing on an events level, which is the sort of day-to-day activity and the tangible outcomes that you'll see me reporting on later, as also as well as acknowledging the system change we're looking to put in the background. So things like the structural changes we need to make sure are in place, developing policy or adapting organisational change to be able to support delivery. Just move on. So you will have seen this before. This is our whole systems approach to healthy weight for Powys. The focus hasn't changed. So following the review and the workshops that I mentioned, we've kept the focus largely the same. So it's around early years, particularly focusing on children aged 0 to 5, families and access to healthy food. But what we have done is adapted the 4 themes under the subsystems just to reflect the progress and the needs of the families in Powys based on things like the report I just mentioned. So we've still got the early years nutrition and accessibility of healthy food as the 2 subsystems, and I'll break these down more in a little bit detail as we go through the sections. So moving on then to our first theme, which is the breastfeeding theme. So we are you know, this is a clear priority, and this one has remained the same for us because there's been a lot of success with this area of work, particularly around the partnership working, that we've had really strong partnership working. I know we've worked very closely with Powys County Council to implement this, and it's working really well. So we're reviewing that and developing it all the time. But ultimately, we're trying to make sure that we looking to change social norms, so things like intervening the intervention around the breastfeeding welcome scheme, and also building policy behind that as well. So we've actually, as of today, we've got a 434 organisations, should I say, signed up to the breastfeeding welcome scheme. So we've had over 10 organisations signed up in this last quarter, and we've set ourselves quite an ambitious target, 500 by the end of March. But the team are really working well towards that, and that we're expecting to be met very soon. We've also got the Powys Teaching Health Board breastfeeding policy, which is to support staff returning to work, and it's just been approved. So a lot of hard work from my colleagues in the team, and also working really closely with colleagues across the health board in different roles in early years settings, midwifery, health visits and so on, to get this up and off the ground now. So it has been approved. So what we'll be looking to do is share that widely. And what we'd really like to see is commitment from other PSB partners to adopt the breastfeeding principles. So where possible and appropriate to your organisation, signing up to the policy and adopting that within their local organisation if possible. In terms of the exposure to healthy food, so this was previously named Introduction to Solids, but we've broadened this a little bit to reflect the exposure to healthy food, which goes beyond weaning, and looks at things like introducing the Gold Snack Award. So we know that children around the ages of 2 to 3, that's when they are most likely to accept newly tasted foods. So what we wanted to make sure is that right from sort of weaning through to being exposed to the Healthy Snack Award within the preschool settings, that we continue to make sure there's continued opportunities to work with those children to expose them to healthy snacks. We've had some really great feedback from the settings themselves, which I'll show you in a second, but also from families, which is great. So families are really starting to feel the difference at home in seeing that their children will eat a broad range of snacks. So this quarter, we've had a further 3 preschool settings have successfully achieved the Gold Standard Healthy Snack Award. So that brings us to a total of 14. And the important thing to note there is we're reaching almost 1,500 childcare places as well. So we're really reaching the children across the settings and continue to push that as much as we can, so that it's widely accepted within the the childcare settings. And then my colleagues are supporting further settings. 28 settings are being supported to work towards completing the requirements to apply for the award. And this again is really good partnership working between public health, dietetics teams, local authority. So it's working really well. Off the back of feedback we've had around fussy eaters and children with restricted diets, the dietetics have worked really well to produce training sessions specifically for the early years staff. So that's just been delivered as well and went down very well. And we've also produced a couple of promotional films to promote the Healthy Snack Award. So I'm going to try and show you one of them now, if you bear with me a second while I just switch between screens.
Helen, I can't hear it my side. I don't know whether that's the same for anybody else.
No, I can't hear it.
Apologies, bear with me a second then.
Those skewers do look lovely, though.
Is it a problem that it's showing from the health system? It would, I don't know whether anybody from the local authority side would be able to.
Well,
I think it's the way it's shared. If you stop sharing and then when you press share on the top right hand side, you have to put with sound.
Okay. Thanks, Emma.
Okay.
It'd be a shame not to hear from the earlier setting.
And Emma, your comment in the chat flashed up as well to confirm that Powys had signed up last year, so that was timely. Was that the, I mean, perhaps we can ask that, we can move on and come back to that if that was the last element in the presentation, or perhaps we can hear the rest of anything you want, or pick up
Apologies,
on any.
or I'll just go back to the presentation if that's okay. I've done all the settings. I know we trialed run it earlier, so it's running our end, but for some reason it's not coming through your side.
Okay, thanks,
I'll send
Helen.
it on if that's okay to be shared.
Thank you.
Give me a second then while I just go back to my presentation. Yeah, sorry about that. So just to say, there's been a couple of videos produced. One of them is just promoting the Gold Snack Award in general, just to encourage settings to sign up. But the other one, which is the one I was trying to show you, was a setting just reporting on how well it's gone for them. And one of the reasons really for wanting to share the video is because it really demonstrates the ripple effects that we are seeing with the healthy weight work. So it's not just what we're intended to do in terms of making sure children are exposed to healthy snacks, but it's all those unintended consequences that are really positive. So things like settings now going on to create their little garden and growing spaces, but also the one setting in particular, which is featured in the video. They share recipes with families and they're getting families more engaged in the conversations around food as well. So really seeing that, you know, what's happening on the ground for real people, really capturing that. Right, and then moving on to food planning and preparation. So this theme of work was adapted to focus more broadly on food planning, preparation and provision. So it was previously looked at cooking skills, but following the findings of the parental engagement work, where we really started to unpick and understand what the mental load means for parents, we started to look at, you know, addressing that and also thinking about the wider food environment and how that impacts families. So we know that around 50% of families report struggling with how to plan and prepare meals, which is largely due to the presence of these overwhelming constraints, really. So it's about making sure we consider that and put the right support in place. So identifying the opportunities where we can change a local food system and implement through just various collaborative working. So the findings from the parental engagement report were disseminated to our local partners, and we've had really good feedback, not just locally in Powys, but across Wales. It's being used as a valuable insight to inform the different system level work we're doing. We also had the It Starts With Food pilot, which was a local Powys pilot, and the evaluation found that it raised awareness of local veg growers, which was fantastic. And we've learned really from the pilot that what we've learned from the pilot is already starting to shape the way we work. So we've, for example, worked very closely with Cultivate to develop a bank of recipe films which are uploaded to their website so that the public can access them. Because one of the feedback we had from that project is people being able to get to physical sessions. And we've also been contributing some of the national work to build a better understanding of public sector food procurement. And provide, you know, the national steer for system change. So, for example, contributing to things like the out-of-home working groups to define what food provision looks like, look at the root causes of the issues, which is largely down to things like procurement, and making sure we've got increased capacity with national procurement teams to make sure they can support the development. And looking at developing standards as well for the public sector so that families are supported to access healthier food out of the home. And then finally, it's the affordability and resilience work stream. So affordability, as you know, is seen as a significant barrier, and this was highlighted even more in the recent Dyfed Powys Food Resilience report, which came out. So we know that 70% of families in the most deprived households would need to spend around 70% of their disposable income to be able to achieve what we recommend with the Eat Well Guide diet. So many households, especially those on low income and geographically isolated, they're really highly sensitive to any price shocks with food and drinks and any supply distributions. So this action really is around supporting families to access schemes to be able to afford healthy and sustainable food. So we've been participating in a national working group to feed back the local challenges to things like uptake on the Healthy Start programme and influence them to look at the barriers to uptake. We've also looked at the Healthy Start training for professionals, which was developed last year. So it's available now for all Powys Teaching Health Board staff. So we're working behind the scenes with the health visiting teams and midwifery teams to look at how we can make sure as many staff as possible access that, as well as looking at developing resources for non-health professional staff as well. So they're given all the information to pass on to the families. And then we've also, you'll be aware that Bwyd Powys Local Food Partnership is leading on the development of food resilience strategy. So we've been maintaining strong partnership links there and working to ensure that we support this work wherever possible, particularly around obviously the link with healthy weights. That's me, so stop sharing.
Thank you very much for that, Helen. I've got a question and then I'll open it up to others if that's okay. I'm really pleased that you're up to the minute here with reporting on the Dyfed Powys food resilience report and the work of Bwyd Powys Food in looking at food resilience and how we can come together on that. We all of the partners in the Bwyd Powys Food Partnership signed up to a series of actions, and it's so you know we each had our commitments there, and I just wanted to double check with you that the actions that the health board signed up to remain consistent with the work that we're doing here on this target area, which is around a whole system approach. And are you tracking and monitoring them within that? I'm just trying to make sure that we're doubly joined up, and if that's something you can answer here, then fine. Otherwise, perhaps we can have a just feed that back in afterwards.
So the actions, what we've just done is drafted our local action plan for the healthy weight work. So we've included in there some healthy weight actions which have been drawn from the food resilience plan. So hopefully there is that consistency of wording, because we have literally carried across the actions to make sure we're aligned to what they're doing. I'm not aware of any wider health board actions, but that's useful for us to know, and more than happy to look at those to make sure that we're aware of those as well, if there are any further commitments we need to consider.
Yeah, I think that would be a useful piece of work, because of course you were talking about procurement yourself, and obviously procurement food going into to homes, hospitals, etc. Programs that the health board might have around helping people to maintain healthy diets within your employee set, etc. So I haven't got in front of me the Bwyd Powys partnership that we all signed up to, but I just wanted to just double check that you know you have cross-checked and are cross-checking there.
Yeah, we work very closely with Bwyd Powys. Members of the Bwyd Powys team sit on our steering group and our working groups as well, so we make sure we've got that strong connection.
Thank you, really important, and it's you know quite a positive update that you've given us today. So any comments or questions colleagues might have of Helen? No, I think you're getting an easy ride, Helen. Just me there inquiring about that. But in which case, just thank you again for doing that. And we'll move on to 4.3, and this is the evidence and insight work that Catherine James is just going to give us an update on.
Yeah, thank you. So in terms of this work stream, it's on track. A significant milestone during the quarter was the completion of the first draft of the wellbeing assessment that will be published next March. So that's been developed collaboratively with all partners and brought forward for the board's consideration later. But it's been quite a feat setting out the evidence base to help inform how we can look to improve wellbeing in Powys. We've strengthened the engagement approach, so the engagement plan that accompanies that assessment has been updated to ensure we're widening participation and capturing a broader range of experiences, and ensuring that insight is gathered at both an overall Powys level but down at a locality level as well, giving a much clearer understanding of insight in the communities across Powys. We've strengthened partnership working, so we've got those monthly engagement and insight network meetings happening, so we've got better coordination across and helping to reduce duplication and align activity wherever possible. The PSB engagement hub's now live, so that's on the Have Your Say Powys site. So we've got a single platform that people can access to share their views when we have anything to for them to engage on. So it is still in development, but we've got an important foundation there to help promote the work of the PSB. And there are links to the current wellbeing assessment and wellbeing plan, as well as our interactive wellbeing information bank, which is a PSB central source of data about Powys. So it's not just for the PSB itself, but it is available to anyone. So I would encourage anyone to go and visit it. It goes down to a locality level as well. It's a whole wealth of information going on there. We've also reviewed and strengthened our data intelligence, obviously through this update of the wellbeing assessment. So the existing data sets that we've got have been improved and expanded wherever possible. Data gaps have been identified and addressed wherever we could. And we've got a clearer publication timeline and methodology for the assessment now in place. So that enables more robust evidence-led planning. So the next quarter would be looking at the public consultation of the assessment, if approved, beginning in July and running through to September, alongside some promotion partner activities as well, which is outlined in a later agenda item. So some of the challenges is that delivery is dependent on the capacity and resources that all partners can contribute to. So capacity, as always, is a challenge. But we are managing it. And we've also highlighted there to agree a clear shared approach to developing and resourcing the next wellbeing plan, because that can take quite a significant time to pull together, on average about 9 months. So we just wanted to highlight that to the board. Thank you.
Thank you very much, and I'm sure there might be more that's picked up under the item 6 and 7 as we come to them on the agenda. But are there any questions that anyone would wish to raise with Catherine at this point? And I should say, if you can let me know your hand is up or shout out, because I've minimised my screen. No? Okay, in which case, thank you very much, Catherine, for that. And like I say, we will return to you and having a more of an in-depth look at the wellbeing assessment under item 6, and as you say, next steps in relation to what we do with that. So thank you. I'll turn now to item 5 on the agenda, which is the Public Service Board annual report. And I'll just introduce this, if I may, with you. I'm really pleased to be able to introduce this again. This is the third annual report of the current wellbeing plan, and the second one since I've been in the chair. And the report is very comprehensive. It sets out, I think, progress that we've made over the last year in delivering our shared vision of a fair, sustainable and a healthy Powys, which is good, as you might expect. And overall, the report shows a year of continued delivery, learning and strengthening of partnership working. And I was really pleased to be take part of the event that Liz highlighted earlier, that took place around the climate work. It really was a seminal moment, I thought. And if I can just go on and turn first to the climate emergency section, we have, I think, taken forward a more coordinated Powys-wide approach as a result of coming together and aided and abetted, as we've said, by the team from Bannau Brycheiniog. We've established the Powys Climate Hub, which itself brings together evidence, information and practical actions all into a single place, alongside delivering engagement activity. And again, Liz has highlighted these things, looking at how we manage risks around fire and water and so forth, and develop the resilient Powys approach, culminating, as we said, in the event that was held. Healthy weights, we've just heard a report there, which was quite positive, and I think we have again continued to build on the strong prevention-focused programme of work that is now really starting to show some results, and this includes the expansion of breastfeeding, a welcome scheme that has been described, and the Healthy Snack Award. Unfortunately, we couldn't just see one of the videos there. But also, clearly, we're developing far more work, direct engagement with families to develop a better understanding of the barriers that parents and young people have to accessing healthy food, and understanding how we might better support them in doing that. And as has been indicated, some of that is about procurement or people's purchasing choices, and others is just about how one prepares and cooks food to ensure that people have the best start in life and continue to age well through the food they eat. On the evidence and insight section, we've strengthened the foundations for decision making, and through the launching of the PSB Hub, we've improved access to data through the Wellbeing Information Bank that Catherine has just described, and that's helped to facilitate the wellbeing assessment that we're discussing shortly. So in addition to that, we've also strengthened government governance and risk management with a more consistent approach to monitoring progress and escalating issues. Improved partnership alignment, particularly between the PSB and the Regional Partnership Board. And there are also emerging outcomes, particularly in prevention, such as improvements in early years, healthy weight, and increased engagement across communities, which has to be good. So in summary, this report shows that the Public Service Board has delivered across all key priority areas, strengthened how partners work together, improved engagement, governance, and the use of evidence. And the focus is now on building on this progress, ensuring that partnership working continues to translate into clear, measurable improvements in wellbeing over the longer term. And as we indicated earlier, ensure that we are adding value to the work that we do individually. And in the area of the of climate emergency, we've had an action to take that away and do some more work on that. So I am open to questions. Did you, Catherine, was there anything you wish to follow up on in respect of the annual report?
No, nothing to add.
Okay, thanks. In which case I'm happy to welcome questions and comments. If you are content, I'm happy with that too. Emma Palmer, Chief Exec.
Thanks, Leader. I've got just a few points. I think the report is a comment really in terms of the report showing that alignment between the wellbeing plan and delivery with that consistent focus on outcomes. So what was also coming through is some of the strengths within the partnership working and that wider shared system approach, which I think is really important and that we continue to build on. The evidence also and engagement in terms of shaping the priorities, but overall I think it does reflect some maturity in the partnership, and what we need to do is keep pace and translate what we're doing into visible impact in the community. So just a thank you very much to everyone, and let's just focus on that impact.
Thank you, and that is always a timely reminder that it's what we do that matters, isn't it? Not just what we say we're going to do. So thank you for that. At which point I will draw a line under that and move on to the wellbeing assessment. But just before bringing Catherine in to say a few words on it, I really would encourage anyone either in this meeting or reporting on the meeting to just have a look at the granularity of the detail which is in the wellbeing assessment that we're due to go out on, or the information is drawn from the wellbeing hub that Catherine referred to. But if you just go and don't read any more than the introductory paragraphs that describes the demography, the economy, the issues that are facing Powys, you will see in stark detail what we talk about when we say we have an aging population, we have a declining workforce, we struggle to keep hold of our young people, etc. We have a housing affordability issue, we have lower wages, we have lower gross added value, etc. It's all there. And of course, the challenge that we then have individually as organizations, collectively as a PSB, is deciding how we choose to use resources to respond to those issues, how we prioritize those and take action, as has just been said, to address the issues that are affecting the population that we are here of multiple communities across Powys. So there's just such an insight, I think, and it reminds me every time I read it. Catherine, I hope I haven't stolen any of your thunder. I'm sure I haven't. You'll be doing it much more justice than myself.
Thank you. Could we just also have a proposer and seconder for approving the annual report?
Oh, sorry, my mistake. So yes, please. I'm certainly happy to propose it. So do we have a seconder? Sean, thank you very much, Sean. Yeah, thank you very much. So can we just have a quick show of hands to approve, adopt that, sign that off? Thank you very much. I'm seeing electronic hands popping up all over the place. So thank you. I think we're good. And thank you for the reminder of that, Catherine.
That's okay. So wellbeing assessment. So the draft, I should add. So this is the draft wellbeing assessment for Powys. It's quite comprehensive, as you can see. It takes up most of the agenda, and it's the third since that's been produced since the Future Generations Act sort of came in 2015. So it provides a picture of wellbeing across the county, drawing together data, evidence, what we know from engagement with the people of Powys to understand the social, economic, environmental and cultural factors that affect people's lives. So under the Wellbeing and Future Generations Act, we are required to consider wellbeing across those four key themes of social, economic, environmental and cultural. And these themes give us a holistic view of life across the county, recognising that wellbeing is often shaped by a wide range of interconnected factors. So you will see that the report looks at 18 themes within those pillars of wellbeing, as you call them, and each section then is broken down into sort of further sub-themes as you look in. As you know, Powys is a large county. It covers a quarter of Wales' landmass. So we do have to use geospatial analysis to understand the differences that we have across the county. So we do use 13 localities to compare parts of the county wherever possible. So, and that does enable the viewer the report, does enable the viewer to drill into data wherever possible. So there are hyperlinks throughout the whole thing, taking them back to our interactive wellbeing information bank. The report does provide, as you mentioned, a demographic overview, looking back as well as sort of looking into the future, as well as benchmarking information to support understanding as well. So the assessment does confirm that Powys does have some strengths. So there's strong community cohesion and we've got high levels of volunteering, some good overall health outcomes with life expectancy above the Welsh average, and high levels of physical activity and community participation, particularly among young people. However, the assessment also has addresses some challenges and pressures, that ageing population you mentioned and that growing demand for health care and housing support, the rurality and access to services for many communities. So they face barriers in terms of transport, digital connectivity and provision. Economic challenges, so lower wages, high self-employment and limited productivity, as well as cost of living pressures, particularly for lower income households, as we saw earlier. And there's often inequalities between localities as well. So there are pockets of deprivation not often reflected at that overall county picture. The emerging risks for the future, so in terms of climate change, so that increased flooding, the extreme weather that we have at the moment is putting pressure on the infrastructure and communities, housing affordability with rising house prices and limited supply, as well as digital exclusion affecting access to services and opportunities for people. So a key message from the assessment is that many of these issues, if not all of them, are interconnected across those 4 themes. For example, poverty, housing and health outcomes are linked. Rurality affects access to services, employment and social connection, and loneliness. Environmental pressures as well in terms of climate change and the impact on the economy, communities and well-being. So this does reinforce the importance of a coordinated partnership approach, as no single organisation can address these alone. So in summary, the assessment does give us a robust understanding of well-being in Powys and the strengths and challenges, and so a strong foundation then to enable us to set future priorities and inform the next wellbeing plan. Thank you.
Thank you very much. I've already said what I wanted to say. Are there any comments on the draft itself? Otherwise, Catherine, can you just take us through the next step? So we're seeking an endorsement to publish this document for consultation, and no doubt you'll want us to do that formally, and then we can move on to perhaps explain what the engagement plan and survey work looks like.
Yeah, the next steps is the next agenda item.
It is indeed.
Yeah.
So I've got 3 speakers. I've got Emma, Richard and Meredith.
Thank you, Leader. I really welcome this. I think we should be using the evidence base to help us shape our future priorities. So you know that well, and I like data, which helps, but it's really important. And I think so taking this forward and understanding from our wider stakeholders is really important. But if I may make a pitch based on the observations of what the data is saying to me already, not for any response today, but maybe for the PSB to consider moving forward. And if any of the public are listening, they can come back with comment. But for me, it's aligning the economic development with skills, transport and housing is essential, alongside targeting at low income households and addressing the rural exclusion, or what could feel like rural exclusion. So I think we really need to consider a strong emphasis on scaling those early help services, including support for families, community wellbeing, those front door services, and looking at how we do that across the system. So we can look at then at how we prioritise our investment that reduces that long-term demand. I appreciate there are competing pressures about the here and now, but actually how do we shift it if we don't genuinely move the funding on the continuum and bring about that change? So it will require us being really explicit about what we stop doing, or reducing low impact and reactive activity. I also think there's an opportunity for a wider workforce strategy across partners in the region is needed, where we can support our own, grow our own approaches, and with the development of local training pipelines because of the challenges that we all face, and also rethinking through service models that should be rethought, particularly around the population that we're serving. But the economy and that alignment and the demand from the economy on public sector should not be ignored. And when we think about being sustainable, actually it's the influence that we can have on the wider economy that will actually determine our demography and the impact that we see on public services. I think that's something that we seriously need to consider. And then in terms of place-based services, we should be looking at integrated place-based services that bring together the different provisions across the area. I think we could challenge or ask ourselves how well are we really doing that? Is there more that we can do? Is there good practice in certain areas that could help shape and take things forward? And finally, focus on that locality level planning and targeting will help ensure that the services are responsive to the specific needs of different communities. And quite often colleagues will hear me say, the needs of Machynlleth might be very different to the needs of Ystrad or Crickhowell compared to Knighton and Prestine, for instance. And so I welcome the information, and I also welcome the ability to delve into the data, Catherine, at that locality level that might shift our thinking in terms of how we do respond on that level. So really welcome this and look forward to the consultation and also what we get back from the consultation. Thank you very much.
Thank you very much. Before I just call on Richard, I just want to make an observation as well and reflect on what you've said there, Emma. And of course, because we're, the public sector, dependent on public sector funding, then obviously there's clear prioritisation in how we use increasingly scarce resources, isn't there? Which we need to think about. But also, as a public body, we have a facilitating role through the actions and we take and the policy framework that we bring forward and develop. And in that facilitating role, I think that there is certainly more we can do in response to what we're seeing here, for instance, in supporting rural affordable housing and helping create sustainable villages and rural communities that can add to that rural resilience picture that we're talking about. And so I think we just need, as you say, to see what feedback we have, but think how we then can facilitate change as well as and provide leadership around that change, as well as doing stuff ourselves. And I'm just putting Diane on notice that I would like to hear from Diane, just to give an extra layer of response around placemaking and locality working that Emma alluded to there, because I know we're doing some really useful transformative work ourselves as Powys in respect of that, and that would be useful to hear more of that here, I think. So just put you on notice, and I'll bring Richard in now if I may.
Thank you, Chair. Yeah, I just really wanted to acknowledge and say thank you to Catherine and her team for bringing such a substantial evidence base together in such a short and challenging time frame, and also to the partners on this call and have sent their apologies, have supported that process. I think it's been quite an achievement given the sort of resource challenges everyone's under. I think having received the latest working draft for endorsement today, there are just a couple of figures and typos that I will pass on to you, Catherine, by email, probably later today or tomorrow. And the only other observation really is that really welcome the opportunity to really develop those cross-cutting themes, opportunities for collaboration, and I'm hoping and I'm sure that will come out an opportunity before that for the forthcoming consultation process. Thank you.
Oh, thank you very much to that. And if and when we do endorse this, we'll do so subject to those typos and suggestions you make, Richard. Who have I got now? Meredith.
Okay, thank you, Chair. Yeah, just a few points. I think it's an excellent sort of document. So, Catherine, thank you for collating and coordinating the completion of the document, and please pass my thanks on to your team as well. And also, similar to what Richard said, really, I know a number of partners have contributed to the document as well. So I'd like to acknowledge my thanks to all partners involved. Just on the data, and with Emma on the data, so element really is how we use data to drive element really, and this is an important document for us to really understand, where are we currently in Powys, and actually what's our aspirations as well for the population going forward, to make sure our plans, align to that. So the public consultation will be absolutely crucial. Just wanted to mention, I know you mentioned life expectancy for Powys. I just wanted to sort of bring out healthy life expectancy. So the healthy life expectancy is different to life expectancy. So healthy life expectancy, and life expectancy is the number of years we live on average, and then healthy life expectancy is the number of years we live in good health element. And I think it would be remiss of me not to sort of mention, really, there is on average about 20 years at that, on average 16 for female, about 20 for sort of males, really, around number of years people live in poor health element, really. And that's something collectively as a PSB that we can work in partnership with the public to highlight. What we want to do is maximise the number of years all of us live in good health. So and the number of years in poorer health actually becomes sort of shorter. So I think that's the key piece in partnership for us, because we have got a number of things that influence our sort of health. And then the local development plan element, really, just be interesting to understand what the crossover is with this piece of work informing the local development plan. And then yesterday at the Regional Partnership Board, we had an excellent sort of presentation on community wellbeing model that has been developed over the last few months in partnership between all our sort of agency from a voluntary sector, local authority and sort of health board. And I just wonder whether that's something that we should be, as we work closer with the RPB, that we bring through as well to the PSB, because I'm mindful not everybody in the PSB is a member of the RPB as well, but we serve the same population. Okay, thank you.
Thank you very much. Emma might have something to say in respect of your last point. Just give some thought to that, Emma. I mean, obviously, I wouldn't want us to just duplicate what we do between one meeting and the next meeting. I'm sure you're not suggesting we do that, just ensure that we have coordinated effort. You make a really sound point in respect of the local development plan, and Diane and I were just talking about where we stood with that. And how the LDP is such an opportunity to be a driving force for whether that is for economic growth and development, or healthy living and healthy lifestyles, development that is protected against heat and cold and flooding and, you know, things like that. Actually, there's a long reach to the development plan, and you will note that the local development plan bases itself on evidence, and this is one of the key areas of evidence that it looks at and seeks to respond to. So I'm sure Diane will continue to make that the case. Now, and I just wanted to observe as well, I'm often found commenting in things that I write about the importance of quality of life as one ages, and so eating well, being active, and enjoying that period of older life in a healthy state. And I've missed the fact that gents hang on for an extra 4 years in ill health. So I will take that away, Liz, and redouble my efforts. So thank you for that. But Diane, I did put you on notice. I can't see your hand. Are you still available in the meeting to come back to the earlier point about placemaking and locality working?
Absolutely.
Oh, good. Thank you.
Yeah, so we've been looking at, under our transformation programme to support sustainable powers, we've been looking at how we work with communities to actually develop better places that are based on the evidence and insight for people living in that locality. So we do have 18 plans for local areas split up into different areas across Powys that are localised, but really still focus on town centres rather than the wider rural communities. So the placemaking portal is designed to reach further than our current plans, and designed to actually create that engagement and input from our communities about really what matters to them in terms of that placemaking. How do we design places that are much more accessible and designed with the people that live there, rather than from a policy that someone else might have set. So the placemaking portal will be going out soon. It's in development. It's already been developed. It's being tested at the moment. We're doing lots of work on that, and that we're hoping that portal will give us a lot more information, rich information, that will help feed future wellbeing assessments, but also help feed the design of services and our funding for future development as well. So I think it will be a really key piece of information that will start developing and influencing all of our decisions in the future, but also the design of our places, which will be a key feed into our local development plan, along with the wellbeing assessment. And I think it's where we can actually challenge in terms of different policies and different practices to ensure that they meet the needs of our population. So we will hopefully put this on the agenda at some point for the PSB once it's live, and just give a quick demo as well, if that's acceptable. Thank you.
Thank you. Certainly it is from my point of view, and as you've described it there, not only does the placemaking feed into the LDP as it comes into being, but actually gives it dynamic life after it's produced. So things don't just get set in stone for 20 years and we wait for the next one. Actually, it's quite dynamic at a locality level. So we're really quite excited to see how that might work. Are there any other comments or observations that colleagues would wish to share? If I don't see any hands, I'm just going to move that we accept or endorse the paper, subject to the changes that a couple of colleagues have indicated they wish to just email in the next 24 hours, and to agree that we go out to consultation on that basis. So I'm prepared to propose that. Do I have a seconder? Just looking for a hand to be raised somewhere. Can't see one yet. Is there anything holding anyone back? Or is my
Leader,
computer
you've had
just...
both Mares and Carl with their
God.
electronic hands.
Well, I've got my blooming people on at the side here and I can't see it. Anyway, so thank you very much for that. I don't know why I can't see that. I do apologize for that. So thank you. So I've got that. So can I just then have a show of hands, please, in the normal way, hopefully. Yeah, and they're not coming up on my my people side. But, yeah, thank you very much. All right, so Catherine, can you take us then to the engagement plan and just set out what we propose, and perhaps just touch on the survey also included in item 7, not in detail, I don't think we need that, but just give an indication indication of the plans that we have.
Yeah, Carl has his hand up. I don't know if Carl wished to come in there.
No, sorry, it was a hand indicating that I was supporting Jake's request, okay. So that's fine.
Thank you.
Yes, so the consultation and engagement plan. So the draft engagement plan that is in the agenda sets out the steps that we'll be proposing to go through. So obviously the engagement with the wellbeing assessment is to gather feedback from residents, different stakeholder groups we already know, as well as partners, test whether the assessment reflects what matters most to people, and it helps to strengthen the evidence base that we've got before finalising the document. So it will be out over the summer for a 12-week period. The consultation would run from early July through to the end of September. Like last time, we would have a public survey on the engagement hub, but a wider communications campaign in terms of social media, digital promotion, engagement across town and community councils and county councillors, as well as some work with other partner organisations and networks as well. We'll also have paper copies at local access points such as libraries and anywhere else anyone would wish to put them, to ensure the process is accessible to all. So the survey itself has been designed to capture meaningful insight, and the questions there are what we asked last time, so we'll be able to understand some trends over time and if stuff has changed in the last 5 years. So we would be asking what matters most to people in terms of their well-being now and in the future. They'd be asked to look at the themes and to prioritise what they think are the most and the least important issues, and to reflect on their own experiences across those 4 wellbeing themes. So as mentioned earlier, we would be analysing that by the 13 localities as well. So not only would we have an overall analysis, but we'd have it per community as well. So throughout that consultation period, we would be actively promoting participation, and once it closes we'd be analysing and refining the assessment as well. I would like to ask if anyone has any other consultees that we may not have thought of that they'd wish for it to be shared with, just to let us know so that we could add them to the distribution list. Thank you.
So any suggestions? Oh, so Emma, I don't know whether that's a suggestion or just, yeah.
Yeah, it is. Catherine, I don't know if I've missed it, but it's young person's voice. I'd really like to hear the views of young people.
Yeah.
And then also when we're doing the analysis, are we able to do the analysis by age? It's just
Yes.
what older, I say older, you know, what adults think young people want isn't necessarily what young people will say that they want for the future, and just thinking about future generations and some of the opportunities there. I think that could be helpful.
Yeah, we do capture age, so as long as they give us an age, we can look at that as well.
Just thinking in terms of rather than just through, you've got a number of different channels here in terms of engagement, but I think more of that sort of face-to-face engagement is also helpful across the summer.
I think that's good. It was only in a conversation this morning that we were talking about Speak Truth to Powys again, and making sure that we capture the young people's voice in everything we do, and so that's really timely. Diane.
I think I'm not quite sure of the response because it's quite a big engagement piece, but I think businesses, to hear the voice of businesses within the economy part might be really useful as well. So we could use our engagement portal from the business side, if that helps.
Yeah, I think given where we are with Grow Powys and the dialogue that we're having with the business sector, and particularly around where the two interface as well, which is learning and skills. And, you know, we've got the post-14 work that we're doing at the moment. We've got the needs assessment over the needs of businesses and young people, preparing them ready for work, etc. So, yeah, I think that sounds very sensible if you can weave that in too. Any other areas that we feel there are gaps that we'd like to add? Sorry, I'm trying to read the chat now. No, I'm not seeing any hands. Sorry, Catherine, are you telling me in the chat that there are hands?
No, I was just noting some of the suggestions people have given, and I'll take those away and make sure that they're added to our list.
Okay, lovely. Now, I guess we probably do need a mover and seconder again with this, do we? Or at least for and just capturing it, in which case I will move this subject to the creative amendments that have been suggested. And again, I'm looking for a seconder, and someone might have to tell me if they've raised a hand or just shout out. I'll hear that.
I'm happy to. It's Mez Bowley.
Oh, thank you very much. Thank you very much. So we have that, and in which case we can just raise our hands to agree that in the usual way. So show of hands. I think that's probably so. David, is that a yes hand? Yes, it was.
Yes, it is. Yeah.
Thank you very much, David. Okay, so we then have at item 8, moving on, dates of future meetings, and we've also just started, made a couple of suggestions for future things to go into that. Is there anything else you wanted to add in there, Catherine? Otherwise, we just note them, don't we, and ensure that our diaries are free.
Not unless anybody else has something to raise. No. Okay, and item 9 is looking at the forward work programme, and again with it, there's nothing detailed there, Catherine. No, so usually we have our standard items, don't we? So for the progress updates from each of the 3, and I know Liz, there will be that report coming around climate to the September meeting. So it's just a request really for any items that anyone wishes to.
Yeah, we've raised 2 during the meeting, haven't we? So those, and obviously if there are any others that colleagues wish to put forward, then please do. It's always good to have a full agenda to have a look at. Okay, so I do have we normally at the end of the meeting have a private session, so we close this down and then just have a quick round the table discussion about just double checking that we've got the right people in the meeting and we all know what we're doing. So if there is no any other business, I will ask Steve to formally close the meeting to the public, and we'll just stay behind if you could for a couple of minutes after that.
Before I do so, Chair, it's probably worth noting that this would have been Ewan Cray's last meeting with the PSB. He's due to retire. I think it's worth acknowledging the work that he's done on behalf of the PSB.
Thank you very much for the reminder, and if we can note that, and perhaps you and I can talk about sending a formal letter of thanks after the meeting.
Okay, I'll stop the recording now.
Thank you very much, Steve.